Pronto? Mi sentite? Sì. Buongiorno e benvenuti.
Good afternoon and welcome to the political American debate. We're going to talk about Obamacare, a topic which is extremely debated in the United States, and it is the most appropriate topic for the festival in Trento this year. Talking with Professor Gruber, who is one of the most renowned experts in this topic, we can get an idea of the political significance of this topic in the United States today. Professor Jonathan Gruber, who is a professor at the MIT Boston, is an expert in health economics. Professor Gruber is one of the architects of the main health care reforms in the United States, starting with the state of Massachusetts with Mitt Romney, the Republican who was then defeated by Obama in the 2012 elections. The Obamacare and the healthcare reform of the Vermont state, which was cancelled, I believe was the most advanced one of all three. Professor Gruber, from the very beginning, has been focusing on health economics. A study he carried out several years ago together with another well-known economist of Indian origin, Jonathan, came to a very curious conclusion, which is taxing cigarettes is a good thing because it relieves smokers from some guilty feelings. At least this is what I understood from that study. Anyway, being the inspirator and the developer of the healthcare reform, Professor Gruber has been at the core of polemics in the United States. 3 years ago, at a meeting of academics, Professor Gruber expressed his opinion describing the political means President Obama had to use to allow for the Obamacare to be passed. Of course, this had to be off the records, but it was reported by the media, and this is why the conflict went on. I mean, Italians maybe do not even imagine how significant this debate is in the United States. I've realized this because Professor Gruber has written not only academic texts, but also a graphic novel that illustrates Obamacare. Professor Gruber has provided the texts to the graphics who have made this very interesting book, which can be bought on Amazon. And I've read the comments. And one person even said, I threw it in the fireplace and I was so glad when it turned into flames. I mean, the issue of the healthcare reform in the United States truly triggers off amazing reactions, passionate reactions. Some people even claim that a previous act. So one of the reasons why healthcare spending has gone up in the United States apparently is a law that requires that if you need help, you have to be taken care of at the first aid station, at the emergency room, before checking whether you got a credit card or not in your purse. I mean, for us, this is absolutely normal, but there are people in the United States who believe that this is not acceptable. So Professor Gruber is often interviewed on TV. He writes articles in newspapers and magazines. Approximately 1 month ago, he published a text in the Washington Post. And it is very important to listen to what he's got to tell us because, as you all know very well, President Trump is now trying to abrogate Obamacare. He has had an act approved of by the chamber that will leave about 20 million people deprived of health care. Trump's team has complained with the Congressional Budget Office for stating the truth, which is that of doing away with care for 20 million individuals. It is not clear what is going to happen at the Senate, but this is for sure a very hot topic, also because, according to a political interpretation, President Trump realizes that this is an unpopular measure, but President Trump might try to proceed in this way, nevertheless, to pay a price to the right Republicans for other acts to be passed. So I'm now going to listen with a lot of interest to what Professor Gruber has to tell us about this very debated topic.
Thank you very much for that very nice introduction, and I'm greatly honored to be invited here as a speaker at this year's Festival of Economics. I'm particularly excited that my children are here because when I told them I was speaking at a Festival of Economics, they thought it was a bad joke. My children think that economics is like broccoli. It's a terrible tasting thing you eat because your parents force you to. And sadly, this is not so different than how most Americans feel about economics these days. Indeed, in America, we now find ourselves in what we call a post-fact world, where truth is consistently defeated by falsehood. This is very depressing to those of us who produce facts for a living. And while there's much that upsets me about the current state of American politics, perhaps the most distressing thing is the shrinking respect for expertise. Experts are increasingly viewed not as a source of learning, but as an object of ridicule. And so it is very refreshing to come to a place where they appreciate the role that expert economics can play in helping us think about the world. So today, I'd like to talk about healthcare reform in the U.S. Now, I could talk for hours and hours about this topic, but I only have a limited amount of time. So in a talk like this, to remind myself to not go on too long, I like to start with a story from my family, which is the time my sister came running into the house and saw my father and said, Dad, where's Mom? I need her. And my father said, Mom's not here. Can I help you? And my sister said, no, you can't help me, and started to walk away. Now, my father was surprised because he has a PhD in finance, and he was surprised she didn't want his help with math. So he said, well, can't I help you? And she said, no, I don't want to know that much about it. So today, I don't want to tell you more than you want to know about healthcare reform. I'd like to talk about three things, and I'd like to hear your questions and hear what's on your mind and learn from you about Italy's perspective on this very important problem. So I want to start by talking about why we needed healthcare reform in the U.S. I then will talk about how the Affordable Care Act, also called Obamacare, was the best possible solution to our problems. And then I will talk about where healthcare reform goes next in the United States. Let's start with some background on the U.S. healthcare system. For most Americans, the U.S. healthcare system is not that different from Italy. Now, that may sound strange to you. After all, in America, we have a system of mostly private insurance, while in Italy, you have a system of publicly provided health care. But really, both systems are just trying to solve the same problem. Who pays for the sick? It's a basic fact in economies like America and Italy that 80% of the healthcare spending is done by the 20% of people who are sickest. What that means is we need somehow to share the risk. We can't count on the sick to pay their own bills. That risk has to be shared somehow. Now in Italy, that risk is shared by the taxpayer. You all pay taxes, and in return, everyone gets to use free health care. In America, that risk is shared by insurers who charge the healthy more than they would need to pay in order to have extra money to cover the sick. Now, for most Americans, this system works very well. About 60% of Americans have health insurance through their employer, and the employer pays most of the cost of their insurance. Another 20% of Americans get health insurance from the government, directly from the government. And in that case, it's either free or a very small cost. The big place where we differ from Italy and every other developed country is the last 20%. These are people who suffered from a uniquely American broken system. And this is a system where insurers could discriminate against the sick in three ways. If you were sick, insurers could deny you insurance coverage. If you'd been sick in the past, insurers could refuse to cover your past illnesses, something we call pre-existing conditions exclusions. You might have heard of that. It's basically fancy language for we won't cover your past illnesses. And then finally, if you were sick, you could be charged many, many, many times more than the healthy pay, with no limit. $100,000 a month, $1 million a month, no limit on what insurers could charge if you were sick. As a result, for these 20% of Americans, there was not meaningful insurance. There was no way to protect themselves against illness. And as a result, most of them were uninsured. What that meant was if they got sick, they did not get the care they needed. Estimates suggest that more than 40,000 Americans every year died from lack of health insurance. Millions of more Americans were unable to pay their medical bills, leading to constant financial stress and personal bankruptcies. This was a terrible and unfair system that led to incredible stress on low-income families who weren't offered insurance by their employer or the government. Now, a sensible person might ask, why couldn't the U.S. just switch to a system of public health provision like Italy? Why not just switch to that system? The answer is that while that might have been possible many years ago, it's politically impossible right now in the U.S. for three reasons. The first is that most Americans belong to a well-functioning system of private insurance through their employer. Most Americans would not be willing to give up insurance they know for some unknown promise from the government. That wouldn't work. Second, we have built up an $800 billion a year private health insurance industry that will not go away without a huge fight. And that's a fight they will win. So that's a second reason. Finally, to move to a system like Italy's would require an enormous tax increase. And most Americans will not support that. Right now, the state of California has proposed a system like Italy's. It would cost $400 billion a year, which is about the entire budget of the state. It's just not going to happen. It's just politically too difficult. So for more than 100 years, we've tried different approaches to reform our healthcare system in the U.S., and it never really worked, leading to an increasingly broken system with more and more people becoming uninsured. Then in 2005, the Republican governor of Massachusetts, Mitt Romney, had a very interesting idea. He said, what if instead of trying to fix the whole system, we just focus on the part that's broken? We'll leave people who are happy alone, and let's fix the part that is broken. And he did so by building what I call a three-legged stool. Okay? The first leg was ending discrimination in insurance, telling insurers that they had to provide insurance to anyone who asked for the same price as the healthy. So they couldn't deny insurance, they couldn't deny coverage for past illness, and they couldn't charge the sick more than the healthy. This is obviously a terrific outcome because it ensures that every citizen can get insurance for a fair price. The problem is that if you do this by itself, it doesn't work. And here's why. If you tell everybody they can buy insurance at the same price if they're sick or healthy, then what will the healthy do? They'll wait till they're sick, and then they'll buy insurance. Why should you buy when you're healthy if you can get it at the same price once you're sick? But remember what we talked about before. How does insurance work? Insurance works by the healthy paying extra to cover the sick. So if the healthy don't join and only the sick join, the insurers can't break even. They will lose money and they'll leave the business. In fact, we saw this in America. In 5 states in America, they tried doing this. And in every state, it destroyed the insurance market. Because insurers said, we're too afraid, we will only get sick people. We don't want to be in this environment. That's why Romney realized we needed the second leg of the stool, the individual mandate, or a requirement that individuals purchase insurance. By mandating that all individuals have insurance, we ensured that both the healthy and the sick buy insurance, so that insurers can provide insurance to all at a fair price. But the problem with the mandate is you can't mandate something that people can't afford. Health insurance is very expensive. For a typical family in Massachusetts in 2005, it cost $12,000 a year. That was unaffordable for low-income families. That's why you need the third leg of the stool, subsidies to make health insurance affordable. So we set up this system where we had fair insurance pricing, we required everyone to buy insurance, and we set in place a subsidy system so that low-income people could afford the insurance they had to buy. And this system worked very well. Within 3 years, we had reduced the uninsurance rate in Massachusetts to 3%. Only 3% of people were without insurance. For comparison, a place like the Netherlands has a 2% uninsurance rate. So that's a very good outcome. And it was very popular. About 2/3 of people in Massachusetts supported the law. Supported the law. It is for that reason that when President Obama got elected, he decided to try a national version of the same law. Now remember, this was a plan developed by a Republican governor. But President Obama was enough of a pragmatist to realize that if it worked, we should do it. So he was willing to do it even though it was really originally a Republican idea. And that's what the Affordable Care Act is. It's the same three-legged stool, just at the national level. Okay? Just to review, first of all, most importantly, as of January 2014, America no longer allows insurers to discriminate against the sick. This is one of the most important victories for social justice in American history. I still get shivers when I think about it. This was an amazing accomplishment. America finally was a country like all other developed countries where people would no longer go bankrupt just because they had the wrong genes or because they got in a bad traffic accident. This was an incredible victory for social justice. Second, to make this possible, we have an individual mandate to purchase insurance. And third, we have government subsidies to make insurance affordable. So the same three-legged stool, and the results have actually been very positive. Okay? Now, I'm biased. Okay? I have a strong view on this. I helped write the law. But I'm only going to cite objective facts here. The fact is that we have cut the uninsurance rate in America almost by half, with more than 20 million Americans gaining health insurance. And we have a stabilized insurance market where everyone can get insurance at a fair price. Now you might ask, well, that sounds great, John, but if that's so great, why is it so unpopular? Indeed, before Trump got elected, more Americans disliked Obamacare than liked it. So why is that if it's so great? Well, the answer, I'm afraid, is that since the day this law is passed, it's faced an unprecedented political attack, which has been highly successful. Opponents have provided fake news and misinformation that have caused Americans to not be able to understand what the law actually does. Now, to be clear, this is a complicated law. I totally accept that. And by design, it didn't benefit most Americans. Remember, 80% of Americans were doing okay. And Romney's original idea was, let's leave them alone and focus on the 20% that need help. And that's what Obama did. Policy-wise, that was a great idea. Politically, not so much. Because that meant that 80% of Americans said, hey, what's in it for me? This law does nothing for me. And then when Republicans came out and said this law is terrible, they said, well, maybe it is. It hasn't done anything for me. And so basically we left 80% of people able to be swayed by political arguments. So what was a good policy idea turned out to have a fundamental political weakness. As a result, most Americans don't understand this law. So for example, if you ask Americans, has insurance coverage gone up or down since Obamacare? We know the right answer. It's gone up by 20 million people. Almost as many Americans think it's gone down as think it's gone up. Or more famously, if you ask Americans if they like the Affordable Care Act or if they like Obamacare, they say they like the Affordable Care Act but hate Obamacare. The famous example, of course, they're the same thing. Now, this does not mean that that Americans aren't thinking about it. It's complicated. And the problem is, when you do a complicated law, it allows an opportunity for exploiting it, for making it sound like it's not doing what it really is. So in the end, Obamacare was a policy success, but in large part a political failure. In fact, one of the main reasons the Republicans took over the government was opposition to Obamacare. It hurts me to admit that, but it's true. But here's the problem. Any changes that Republicans make to Obamacare just make things worse. For example, the individual mandate. Now, this is the least popular part of the law. People do not like the individual mandate. Okay? Once again, they don't understand it. If you ask people, do you like the individual mandate? 2/3 say, no, I don't like it. If you then say, do you realize that if you already have health insurance, the individual mandate doesn't affect you, then 2/3 support it. So once again, people don't understand this, but they don't like it. So the Republicans have said, well, great, we'll get rid of the individual mandate. But I hope you can see the problem with that. If you get rid of the individual mandate, healthy people leave the insurance pool, only the sick are left, and insurance prices go through the roof. They get very, very high, and insurers can't make money, and they leave the market. This is not, once again, pure economic theory. We have plenty of that at this conference. Okay? This is real evidence. 5 states tried this, and every time it failed. If you're going to require individuals not discriminate, you have to have the individual mandate. So another example is the actual regulations that end discrimination. Republicans could just say, fine, we'll get rid of the individual mandate, and we'll also allow insurers to discriminate. The problem is that's very unpopular. People like the world where insurers cannot discriminate. They find it very unfair that insurers could discriminate, and no one wants to go back. Very few people want to go back to the days where insurers could charge you more just because you were sick. As a result, the current Republican alternative to Obamacare causes 23 million people to lose health insurance, okay? And to cause the poor and the sick to pay up to 10 times more for health insurance than they pay under Obamacare. Now, here's some good news. In this debate, those facts have mattered, okay? As I said earlier, I was worried that after this election, we would be in a world where facts no longer mattered, where politicians could do whatever they wanted. After all, Trump lied all the time and got away with it. I thought politicians could just do whatever they wanted and get away with it. Here's the exciting news, which is when these numbers come out, they've affected public opinion. This Republican proposal is now incredibly unpopular. Only 1 in 10 Americans supports the Republican alternative. In addition, Obamacare has become popular. For the first time, more than half of Americans support Obamacare. For Americans, I think Obamacare is like the girlfriend you leave for someone better. And then you realize maybe you shouldn't have left. And now I think they want to come back. So I'm hopeful that we'll keep Obamacare, or at least change it in only small ways. But in the end, neither Obamacare nor the Republican alternative fully addresses the most important fiscal problem facing the United States, which is the rapid rise in healthcare costs. Healthcare costs in the U.S. have risen from only 4% of our gross domestic product in 1950 to over 17% today. If nothing is done, they will rise to over 40% of GDP by 2100. Okay? Now in Italy, meanwhile, costs are 1/2 as high, 9% of GDP. Now you might ask, why is that? If you look at health outcomes, Italian health outcomes are no worse than American health outcomes. Now, to be fair, American health outcomes also aren't worse. If you look at statistics and they say, well, Americans have the highest infant mortality rate, that's actually not a fair comparison. For people like myself and my children, U.S. healthcare is the best in the world. A white baby born in the U.S. today has the same infant mortality rate as a baby born in Scandinavia. A black baby born in the U.S. today has a higher infant mortality rate than one born in Barbados. Okay? The problem with our system is not that healthcare is good enough. It's that people don't have access to it. That's what Obamacare is trying to fix. But once people get access, our healthcare is good. It's just not that much better. And it costs twice as much. So what's going on? Well, there's a couple of things going on here. A minor part is the way we treat patients. We treat patients much more intensively when they get in the hospital. But the truth is, most of the difference is simply unit prices. Prices for a doctor, especially a specialist, like an orthopedist or a dermatologist or some other specialist. Prices for the hospital, prices for medical devices like a new hip or a new knee, and prices for drugs. Those prices are all much, much higher in the U.S. than anywhere else in the world. And that is the primary driver of the higher healthcare costs in the U.S. Now, why is that? You might say, well, that's great. Here's the answer. We just lower those prices in the U.S. and the problem's over. Well, the difference is quite simple. In the rest of the world, like in Italy, you are willing to regulate your prices. In the U.S., we are not. So in Italy, the prices you pay for all your medical goods are regulated through negotiation between the medical providers and the government. In the U.S., we don't regulate those prices. We leave it to the private market to set our medical prices. But the problem is that this is a market that suffers from many failures. And as a result, prices have grown rapidly. In many markets, hospitals and specialists are monopolies with no real competition. And we know from economic theory, a monopoly will not charge the welfare maximizing price. A monopolist will charge a price that's too high. That's why economic theory suggests that monopolists need to be regulated. Okay? Even in big markets like Boston, with many hospitals, consumers still cannot shop. I mean, think about it. If you're in the back of an ambulance with a heart attack, you're not going to say, well, take me to that other hospital. I want to see if they're cheaper. Okay? That's just, we can't shop for health care. As a result, even in big markets, certain hospitals set very high prices and get away with it. Okay? So basically, this is a situation where really there's a clear market failure. There's a clear market failure. And basically, we need to figure out how to deal with these rapidly rising prices. Now, one solution, of course, would be price regulation. We could regulate the prices. But the problem is that price regulation is politically incredibly challenging in the U.S. I'm sorry I keep blaming everything on politics, but it's true. Okay, economics is not the problem here. Okay, it's the politics. Price regulation is very, very tricky. Okay? Not surprisingly, healthcare providers like their high prices. Okay? They like the fact that they get paid extra money, and so they will fight hard against government interference. So let me give you one recent example to illustrate the problem. In the U.S., for senior citizens, we have a public program called Medicare. Medicare is free public insurance for the elderly. And Medicare reimburses doctors and hospitals, just like your government reimburses doctors and hospitals. And in particular, if you're in a hospital and you need to get an injectable drug, like for some kind of injectable drug, then the way Medicare pays is the doctor gets paid 7.5% of the price of that drug. Okay? So if I'm a regular doctor and I give Stefano a $100 shot, I get $7.50. If I'm an oncologist treating cancer and I give him a $1,000 shot, same effort, right? All I did was this. I get paid $75 for the same thing. Now that makes no sense, right? We're at Festival of Economics. We understand that's a terrible way to pay for things. So what happened was 20 senators wrote a letter to President Obama and said, this is a broken system. We need to change the way doctors are paid. And President Obama responded. He proposed a new system where doctors got paid a flat amount plus 2.5%. Now, there shouldn't be any percent. That part should go away entirely. But he understood politics a little bit, and he said, fine, we'll give a flat amount plus 2.5%. Budget neutral. Same amount of spending overall, just a better system. Well, I think you can all see what happened. 80 senators, including the original 20, wrote him a letter saying, how dare you propose such a radical revision of the American healthcare system? This is awful. You can't do this. Why did they write that letter? Because the oncologists lobbied them. The doctors liked giving their $75 shots, and they didn't want to go away. And as a result, the Obama proposal failed. So now we still have this broken, horrible system of paying doctors for the same effort 10 or 20 times as much. Okay? So basically the question becomes, in the U.S., can we control prices without regulation? Now, once again, there is some good news here. The good news is since Obamacare passed, healthcare costs in the U.S. have grown by the slowest on record. The slowest growth in our history since World War II, since we started measuring healthcare costs, has been over the last 7 years. Okay, relative to GDP, relative to our economy. It's the slowest it's grown. Why is that? It's because private employers and insurers have started to say no. They've started to say to expensive hospitals, no, we will not pay for people to go to you. They set up what we call narrow networks, where people can only go to certain hospitals that are less expensive and not the most expensive ones. We've also started charging people a lot more for their health care. In the U.S., 15 years ago, whenever you went to the doctor, it was just $10. Now most Americans have a deductible where you can pay $1,000 or $2,000 or even $5,000 for health care. Now, once again, thanks to Obamacare, that deductible is income rated. What I mean by that is if you're poor, the deductible's lower. So it's not, for someone like myself, a $5,000 deductible. While it sounds like a lot, that's actually pretty reasonable. If you think about how much the U.S. spends on health care, I think it's pretty reasonable to ask someone like myself to pay that much. And for those reasons, we've actually begun to reduce the cost of health care, slow it down. But the question is, can this continue? I mean, there's only so many hospitals you can cut out of the network, and only so much you can ask people to pay before the system doesn't work. So can this continue? And if not, will the politicians finally be brave enough to regulate prices? Now, I don't know the answer to that, but I do know that when the time comes to regulate prices, the first thing that will be regulated in the U.S. is drug prices. And the reason is because people are sick of seeing the drug commercials. Now, you don't have this in Italy, but in the U.S., the drug providers, like, all prescription drugs actually advertise on TV. And so let me end with a true story. I swear this is true. That's told to me by a pediatrician friend of mine. Okay? A 9-year-old came into his office and said to him, I'd like to ask you about Cialis. Now, if you don't know, Cialis is a drug for male impotence. Okay? So my doctor friend was surprised, and he said, why are you asking me? And the 9-year-old said, well, I was watching football, and the TV said, talk to your doctor about Cialis. So that's what I'm doing. And I believe that this will be, ultimately, people are getting mad enough about this that we may at some point be ready to regulate drug prices. But it's not happening soon. So I think in the near term, it's going to be up to the private sector in the U.S. to continue to figure out ways to squeeze healthcare costs. But in the long run, it's hard to imagine how we can get our healthcare costs under control without more of an active government role. Now, I could go on speaking, but as my children can tell you, I get very boring. So I would rather hear your questions and have a more general discussion if there's questions to be asked.
Bene, anch'io sono molto...
I'm also eager to accept your questions. I didn't introduce myself. Actually, I write for La Stampa Torino, a daily, an Italian daily. Actually, before accepting questions, I have here a list of the quality of healthcare in the world based on the Lancet data, which I believe is one of the best journals in the world in this respect. So in the first 20 ranking countries in the world, in terms of quality of healthcare, 17 out of that number are European countries. And then we have Australia, Japan, and Canada. And United States ranks 35th. If we compare with Italy, and you see, averages were explained earlier on by Professor Gruber. We know, based on averages, that some are very nicely treated and others are not. But if we simply consider averages, in Italy we are better treated for almost all diseases. There are approximately 20 diseases in this list. And only for some types of cancers, including leukemia. In those cases only, in the United States, treatment is better than in Italy. So you see what problem we have here. We always complain about our healthcare system in Italy, and we also have huge problems of corruption in Italy that also have to do with this. And yet, even though we complain about things, and correctly so, the quality of the healthcare we receive is pretty good when compared to other countries in the world. And health systems, of course, are different. Many are financed by the public, by the state, but there are differences even though there is the government paying, for instance, in Italy and many other countries. Professor Gruber very well explained how difficult it is to change things in the United States, which enjoy a special situation when compared to the rest of the world. So let's accept questions now.
Before the question, I think that's an excellent point, which is that, first of all, there's corruption in all healthcare systems. So in the U.S., 2 of our major insurers just agreed to pay the government $32 million because they were cheating by saying patients were sicker than they were, so they get paid more by the government. So this exists in all systems. I think, once again, what's unique about the U.S. is how unequal our system is. And it really is it is an excellent system for people like me. Okay, my wife is a survivor of breast cancer. She got the best possible care. It was, really, I couldn't have asked for a better situation. But what's disturbing in the U.S. is many, many Americans can't benefit from that system. And the truth is, if you were in outer space and you didn't know if you'd be rich or poor, and someone said, where would you like to go? You should never choose America. But if someone said, yes, I'm sure I'll be rich, America would be a perfectly fine place to choose. Use the mic.
I wanted to know if specific funds were used to finance...
Use the mic, I think.
The Affordable Care Act. Shall I repeat that?
Yes,
then?
please.
Yeah. Were specific funds used to finance the Specific Care Act?
So the question is whether there were particular funds targeted to finance the Affordable Care Act. And that's a very good point. I think a very important policy stand and a very ultimately costly political stand is that President Obama insisted that the Affordable Care Act be budget neutral. He said it must not increase the deficit. So the way it was financed was half through spending cuts and half through tax increases. The spending cuts were reductions in what we pay for Medicare, which is health insurance for our senior citizens. The tax increases were mostly tax increases on the wealthy, which is part of why Republicans are so upset. But most importantly, the Affordable Care Act actually lowered the deficit and increasingly lowered it over time. The estimates of the Congressional Budget Office were that the Affordable Care Act lowered the deficit by $100 billion in the first decade and by more than $1 trillion over the next decade. Now, politically, that was a huge mistake. Why? Because if Obama instead had taken that extra money and thrown it at the other 80%, he might have bought some more support for the law. Indeed, we can actually see a comparison, which is in 2003, George Bush introduced a big new health care program providing drugs to seniors. That program, when it passed, was also very unpopular, but it quickly became popular. Why? Because he just paid for it by blowing up the deficit. So it was our children's problem, not our problem. So unfortunately, I think the Affordable Care Act was very fiscally responsible, and that ended up being, I believe, a political cost. Let me just mention one other thing, because it's very, very, very important about the larger way we think about economic policy from the U.S., is to talk for a minute about the Congressional Budget Office. Okay, in the U.S. before 1974, when the government proposed policies, the government just announced what they would cost, and they just made it up. They just said, well, we think it'll cost this. So, for instance, when Lyndon Johnson introduced Medicare, he lied. He said it would cost 1/10 of what he knew it would cost. And he introduced Medicare, and it passed. Okay? That is a totally inappropriate way to make public policy. And so in the 1970s, the Congress set up the Congressional Budget Office, which is a nonpartisan institution, not Democrat, not Republican, just an expert institution. Many of my PhD students and other PhD students go to work there, and their job is to provide objective estimates of the effect of government policy. And that job is critical, because as we can see, we now have an administration that has no problem with lying. They would be happy to just deny the facts. And the truth is, this may be a change in America. This may be the beginning of a long trend in America, where basically the facts are no longer part of the political conversation. And the only way we keep them in is the Congressional Budget Office. So this is a critical institution, and it's very important to keep an eye on it. It's getting criticized right now by Trump. In the past, it's been criticized by Democrats. That's great. As long as it's criticized by both sides, that's exactly what we want. Okay? But we have to keep an eye and make sure this remains independent. That's crucial to our democracy in the U.S.
Hello. Thank you for explaining us the rationale behind Obamacare. You mentioned the Netherlands in your speech, actually. The latest Dutch reform, healthcare reform, introduced an insurance system which somehow reminds me the US one. So anyone now in the Netherlands must subscribe for insurance. But by doing that, they kind of generated competition among hospitals that now compete on the basis of quality of care and prices. To what extent is it possible to replicate such competition, especially in terms of quality of care, among the US hospitals?
Yes, that's a great question. There are many different healthcare systems around the world. Italy and the UK have what's called public health provision. Other countries like Canada have national health insurance. Countries like Switzerland and the Netherlands, they have a system much more like what we set up in Massachusetts, what we call a managed competition system, where there's private insurance and individuals. Actually, the Swiss mandate came in before the U.S. mandate. That's one case we studied in setting up the U.S. mandate. The Swiss mandate was in 1996. And it's a private-based system that basically is set up to provide competition among insurers. But that's regulated competition. All insurers the underlying medical package costs the same. Insurers just compete over advertising and some small things. And the prices to hospitals are largely regulated. There's a little bit of competition on quality, but once again, all the prices are highly regulated in that situation. So really, there is nowhere I'm aware of that has a non-regulated solution to this problem. Now, once again, as an economist, regulation is the last resort. I'd prefer to have the market solve it. And I'm not sure I would. And in fact, what's interesting is the U.S. had a very regulated healthcare system back in the 1970s, and we went away from it. It had a lot of problems. So I'm not necessarily saying we should go back. What I'm saying is we maybe in the next decade we do need to go back, because I just don't see the private sector solving it.
Thanks, Jonathan. Very fascinating speech. You mentioned the difficult or impossible shift from an expensive private system to a public provided one in the case of US. What about the opposite? Thinking about Italy, we have a publicly provided system financed through general taxation and social insurance contribution, but we are observing a trend towards a more privatized system. So from a social welfare perspective, I think it can be wrong, but the other way it also can make more resources free for the system as a whole.
That's a great question. You have a very high tax burden in Italy compared to the U.S. If you took Stefano's chart and did tax burden, the U.S. would look a lot better than Italy. I think clearly the right answer is some mixed system. That's what economists always say. We don't have an answer, right? But I think that the aspects of the private system that would be most beneficial to Italy would be more consumer engagement and choice within a regulated system. So I think that competition, I think that moving away from regulated prices would be a mistake, but you could have great quality competition within a regulated price system if individuals had more financial incentives and more ability to shop across different sources of care. And you could maybe even allow some small price differences to reward that. So in Italy, your health care is free for the doctor, and there's small costs for specialists in hospitals. That can lead to overuse of care. I think there's clear economic evidence from the U.S. that if you charge people a small amount, they use less care and they're no sicker. So there's a number of studies dating back to the famous Rand health insurance experiment in the 1970s that showed that when you charge people for health care, they use less health care and they're no sicker. So I believe that the place that Italy would want to go, if it was thinking about a more private-based system, would be to get consumers more engaged. Charge consumers a little more for their care, for their drugs. Differentiate across drugs more so that people are forced to use the lower-cost drugs than the more expensive ones. I think that introducing the market on the consumer side is a much better place to introduce it than on the producer side, where I feel like private market competition just does not work.
You already said policy-wise you're quite happy with the reform you inaugurated, but politically you did some mistakes, along the way. What would you do if you had the possibility to start over again to introduce it better into the mainstream?
That's a great question. I think actually I would have done a couple of things. One is I wouldn't have been, if I was king, I wouldn't have been so fiscally responsible. I think if we'd spent another $100 to $200 billion, we could have made this much more politically acceptable. I think that would have been a small amount to pay for a law that does so much good for America. In particular, as I mentioned, to go into a little more detail, 80% of people were largely unaffected. For the other 20%, about 17% of them were winners, but about 3% were losers. Now, who were these losers? They were people who benefited from the previous discrimination. Young and healthy people who could get insurance for cheap prices because the sick people were kicked out of the system. So before Obamacare, in California, you could get insurance for $100 a month if you're young and healthy. If you were sick, you couldn't get insurance. When we set up this new system in California, everyone could get insurance, but it cost more like $300 a month. So for a young, healthy person, they said that's unfair. That's a 300% increase in what I have to pay. Now remember, if you're low income, you didn't have to pay that because Obamacare came in and helped you. But for a middle or higher income young person, they were losers in this system. They essentially had won the lottery before, and now we were taking away their lottery ticket. They benefited from discrimination, and now they didn't anymore. And they were mad. And I think I must have gotten emails from every single one of them. Okay? I got emails from so many people. I had to pay this much more, I had to pay this much more. And, you know, the truth is I didn't have a good answer, except I'm sorry, but quite frankly, you should be happy for how little you paid for so many years because basically you benefited from discrimination. That answer didn't work so well. What we should have done is we could have created no losers by simply taking $100 billion and giving it to insurers and saying, don't raise the prices on the healthy. We could have done that. It would have cost less than $100 billion because it was a very small share of people. Then we would have created no losers, and that would have greatly reduced, even though it's a small number of people that had a large megaphone, they had Fox News. Okay, so these small number of people had a great voice. And I think if we'd said nobody loses, which it would have been pretty cheap to say, the law would have been a lot more successful. Now, to be fair, the other thing to realize is part of the reason the law wasn't successful was because the law was never actually implemented. So, for example, in the law recognized that insurers might struggle to make money. So the law set up something called a risk corridor, like a hallway. A risk corridor is something where we said to insurers, if you lose money, we will help you for the first few years. But if you make money, we're going to take some of that back. So it was reinsurance of the insurers, which is a very smart thing to do when you set up a new insurance market. Indeed, under President Bush's Medicare Part D, that's exactly what they did. This was a Republican idea. So Obamacare, we set up this risk corridor. The problem was in 2010, the Republicans gained the Congress, and they refused to pay the money. So insurers were supposed to get $8 billion that they never got. And that's part of why some of them went out of business and have left the exchange. So to be fair, part of the problem with Obamacare is it never got a fair chance. So I think what I would have done is I would have implemented the law as it was written. I would have put some more money into it to create no losers, and I would have recognized that we need a much more aggressive public relation campaign because this was very unusual. Remember in America, I don't know how it is in Italy, but in America, usually you fight over a law, then it passes, then you move on to the next law. That didn't happen here. The fight never ended, and I think we weren't ready for that. We weren't ready for the fact that the fight continued. Indeed, 3 years after Obamacare passed, many Americans still thought it hadn't passed yet. Why? Because there was so much fighting over it. Okay? So I think the Democratic Party and supporters of the law weren't prepared for that, and I think I would have been more prepared for that.
Qui e poi dietro.
One quick question and a more complex one. Do you think that part of the challenges to make accept the Obamacare was the fact that it was commonly called Obamacare, putting the focus on the president rather than on the action and the content? Second consideration is, as a subject matter expert, how do you see the role of innovation in healthcare system? In Italy, US is an example of innovation in this area with strong research investment, both from the industry and the hospitals. And in Italy, we see that, especially in the hospital and the service management, there is very little innovation and very little efficiency seeking. We decided to control the healthcare spend to focus most on the pharmaceutical spend because it was easier and more politically acceptable in a way. It didn't involve jobs and unions, huge negotiations. So innovation now in Italy, personally, I see it demanded to the private hospital providers that are the only ones that are being able so far to reinvent the service and bring the efficiencies that shall benefit the whole system. I'm curious to see your point on that.
Okay, those are really good questions. So, first of all, on Obamacare, you're absolutely right. A lot of the opposition to Obamacare was opposition to Obama, as witnessed by my point about people liking the Affordable Care Act but not liking Obamacare. Now, on that, I think Obama handled it exactly right, which is he realized no matter what he said, it was going to stick. So he accepted it. He said, yes, I do care, and I'm fine with Obamacare, which was a smart move because it was going to stick no matter what he said. But really, it just speaks to the political opposition of this law. A lot of it was just political opposition to Obama. So here's one example. Under the law, the federal government gave money to states to insure their very poorest citizens under what's called the Medicaid program. Medicare is for our senior citizens. Medicaid is for our poorest citizens. So the government said to states, if you expand the Medicaid program for your poorest citizens, we will pay for it. All you have to do is just pass the law to do it. States run this program, we'll pay for it. So this was a no-brainer, right? I don't know what the Italian for no-brainer is. A very simple decision. The federal government will give you money, and you'll cover your poorest citizens. But as of today, 19 states have still said no. Let me be clear. Take the state of Florida. There are 1 million uninsured people who would benefit from this law, and it would deliver billions of dollars to Florida every year from the rest of the country. And Florida's saying no. I mean, it's unbelievable. And it's because it's Obamacare. Okay. Now, on your second question, innovation, very, very important. This is what I was very glib about the role of regulation. I said, oh, we can just regulate. But the reason I'm wary of regulation is because it can eat into innovation. Our drug prices are by far the highest in the world. But a lot of that money goes into research and development. Some of it goes into terrible advertisements, but a lot of it goes into research and development. And we've invented incredible drugs that have done wonderful things for our society. And I wouldn't want to see that end. So the question is, how can we regulate those prices without eating into the innovation? And the answer is, we need smart regulation. And what does that mean? This comes a bit to the other question about moving Italy towards a more private system. Smart regulation means saying we will allow high prices for drugs that are effective, but not pay for drugs that aren't effective. So, for example, in the last several years, a new drug came along called Sovaldi. Sovaldi saved people with a disease called hepatitis C, a disease of the liver that was killing many thousands of people in America. It literally saved their life. Now, it cost $84,000, but it saved their life. That's a very good deal by U.S. standards. On the other hand, we have drugs that cost $200,000 a year and make you live 1 week longer. Okay? That's a bad deal. So a smart regulation would say, we'll allow the first one and not the second one. That would provide incentives. That way we could lower our spending but still have incentives for innovation. That's the smart way to regulate.
Good afternoon, thanks for being here. I got one point about Sovaldi, and is that one pill in US costed $1,000, if I'm not wrong. In Egypt, the same pill was $11.
Right.
So we still have some questions about how should be the expense and the price for one pill.
Let me just say one thing about that, because that's important. It's $11 here because we did all the R&D. So that's now cool. You have a free rider problem where the U.S. does the R&D and the rest of the world pays low prices. That's good for you, bad for us, and the U.S. has to figure out how to deal with that.
No, sure, but all the rest of humanity has to deal with that prices.
Right.
It's a weird balance to do.
Right.
And I want to think about what you just said. about that million people who were supposed to get the Obamacare, but since it was Obamacare, were opposing the reform. And I'm thinking, is there really a cultural change in U.S. in the way you think about public spending and the way you think about money and the healthcare system? Is there really a cultural chance for such a reform? I mean, is really in the American minds a reform that make everybody spend more in order to cover for the weaker?
Well, it's a great question. I could be pessimistic and say yes, but I think I'm a little more optimistic because look at what's happened with Obamacare. It did pass, and now it's popular, and there's, I think, a very good chance it won't go anywhere. Now, there's still a chance it could go away, and that's very disturbing. But I don't think Donald Trump was elected because people really, really wanted their health insurance to go away. He was elected for many other reasons. Okay, and so I think there is still room for major change in the U.S. I think it's getting increasingly hard. I think essentially the U.S. is moving towards more of a parliamentary system, where basically unless the same party controls the presidency, 60 votes in the Senate, and the House, you can't get anything passed. Okay, so I think, because even now, the Republicans have the Senate, the House, and the presidency, but they don't have 60 votes. So they can't make major change because with 40 votes you can have a filibuster in the U.S. Senate. So basically I think we're going to be a place where only when one party is totally in power can we see major change. But I think in that situation we may see major change. And once something happens, it's hard to take away. Americans like their benefits, and once they have them, I think it's hard to take away. So I don't think it's the end of major change, but I think it's very, very hard. Look, it took us 100 years to get something like Obamacare. Every 17 years, U.S. presidents would propose major health care reform. Truman did it. Nixon did it. Clinton did it. Obama did it. Every 17 years there's a proposal. Okay? And it took that long to pass it. So it's a hard process, but I think it can still happen.
Bene, mi pare che il nostro tempo...
Very well. I think our time is up. So I would like, first of all, to thank very much Professor Gruber for his wonderful contribution. That was crystal clear. If I may, I would only like to say something about the private-public partnership in Italy. In this case, in Italy, we have bad incentives in that private businesses are incentivized to play tricks on the state in Italy instead of doing something beneficial for all. And we should review the situation we have in Italy, of course, based on that. Thank you very much.